Hello, and welcome back to our series by Bluelight on light curing excellence. Now we're going to go ahead with Module 2 for health and safety. We're going to start off with eye protection. What is the best option to keep your eyes safe? How many of you don't wear proper eye protection but turn away from the light and feel that you're protected? Let's take a closer look at what you should be doing. So, you're going to see at the top, here we have tip shields, light shields, paddle shields, and glasses. Let's start off with tip shields. The advantage of using tip shields is that they attach directly to the light. The limitations are reduced visibility and increased distance to the restoration. This is because tip shields get in the way. Another limitation is reflected light may not be completely blocked. With light shields, again an advantage is that they're attached to the light. Limitations are the limited angle visibility and limited protection for the operator. Light shields may also limit how the light can be oriented during curing. For the paddle shields, we see these often in many dental practices. The advantages are that they provide good protection and coverage, and they are quick and easy to use. The limitations are that they require four-handed light curing, since someone must hold the paddle shield. So, what happens if the dentist has to step out of the room to go to a dental hygiene exam, and the dental assistant is left to finish curing on their own? Lastly, are glasses. The advantages are that glasses are hands-free and provide good visibility at all angles. The glasses are the best option for two-handed light curing. However, new requirements for personal protective equipment, or PPE, might limit their use. We want to make sure when using glasses that they are cleaned every time, so when a patient puts them on, there aren't any streaks or oil from a previous patient or from your wipes. I also want to make sure for yourselves that you use proper eye protection as you have a long career ahead of you. We talked about heat and testing a light on your hand in Module 1. Here, we want to look at when tissues are most at risk during light cured procedures. In the first picture, you can see the light tip overlaps soft tissue when the restoration is near gingiva. As a result, light energy is delivered directly to the gingiva, and tissue may be damaged if no steps are taken to limit heat building up. So, curing near gingiva puts soft tissue at high risk of damage from overheating. Care must also be taken when there's less than a millimeter of dentin separating the pulp chamber, as shown in the second picture. This is because there's not much dentin protecting the pulp chamber when the curing light is directed towards it. The pulp chamber may be damaged if too much heat builds up. However, once the material has been placed, as shown in picture 3, the pulp is well insulated and heat management is no longer a concern. In the Bluelight app, you'll see a yellow heat warning symbol in your test results. The heat warning indicates the point at which the light could damage soft tissues if you don't break up your curing cycles. So, a 10-second heat warning means that if you cure for more than 10 seconds, you could damage soft tissues if you don't break up your curing cycles. If you need to cure for 20 seconds, you should use 2 cycles of 10 seconds instead of 1 cycle of 20 seconds. Alternatively, you could use a steady stream of cool air to cool down the soft tissue while curing. It's important to understand that every material needs a certain amount of light energy to be fully cured. Your curing light provides that energy. There are 2 ways you can find curing times. The hard way is to look up the curing time in the material instructions. For example, if your light test tells you that your LED light measures 1500 milliwatts per centimeter squared, then you can look at the material instructions to find the curing time corresponding to the light output and material increment depth and shade. In this example, the correct curing time would be 10 seconds for a translucent shade and 2 millimeter increment depth when the LED light output falls within the range of 1000 to 2000 milliwatts per centimeter squared. However, it's a lot of work to look curing times up when every material has different energy requirements. Also, light output can change from day to day because the tip gets covered with debris or the light is dropped accidentally, etc. And sometimes material instructions are not very clear. Therefore, the easiest way to get your material curing times is from the test results in the Bluelight app. Blue light does all the hard work for you by determining the curing time based on the material instructions. If you really want to look at the instructions, you can find them in the app too. To clean your curing light, Cavi wipes are all that you need. Clean the light shield and handpiece by wiping thoroughly with Cavi wipes or equivalent for 30 seconds or until visibly clean. The key word here is 30 seconds. We've seen many of our dental industry friends wipe the curing light, but only for about, maybe 5 or 6 seconds. So the key here really is 30 seconds. For disinfection, you want to use an alcohol quaternary ammonium wipe, which is, for example, Cavi wipes. Then there's light guide cleaning. Again, just wipe the light thoroughly with Cavi wipes for a full 30 seconds. There are other alternatives for light guide cleaning, but we don't see these very often out in the workforce. Lastly, a helpful tip that we have here is that if composite is stuck and the Cavi wipes aren't working, 1. Soak the light tip in alcohol for a few minutes, and 2. Use a plastic instrument, such as a PFI, to gently scrape the composite off. Have you ever thought about your curing light unit and infection control? Using infection control barriers is important, but you should know that they can affect the output of your light significantly. You should test your curing light with and without your barrier, since your choice of infection control barrier can affect your light output by as much as 30%. Testing without a barrier lets you know if your light is working as the manufacturer said it should, which is important if you think your light may be damaged or need replacement. Testing with a barrier lets you know what energy will be delivered when you cure, and so you should use this test result to determine the curing time. So what do you need to know about infection control barriers? The upper left pictures show lights with crevices that can trap contaminants, so they need barriers because they can't be cleaned easily. Non-transparent barriers, such as the top right photo, reduce light significantly. Always use a clear barrier. The red arrows on the bottom picture show the barrier seam sticking out in front of the light tip, which can force the light tip to be further away and can block the light. It's important to ensure the barrier is properly fitted and that it's flat over the light tip. So consider these things when choosing a barrier: opacity, fit, and placement. Thank you so much for completing Module 2 with us. I'll see you again in Module 3.